this lecture. So let's check the list here. 66 students. Participants are here. Then, after revising the lecture, record of lecture, we will mark them as present, and everyone who is not here will be absent. So here, for any questions, if you want to add something to my explanation or have some questions to explanation, so please type it in chat. And we will and I'll try to answer your questions along the explanation. So, okay. So let's start. Cell injury, cell death, and adaptations. So that's the first real pathological topic. So previously we discussed preparation to this topic. Actually, we learned the normal events with a little correlation with pathology. But now we discuss the pathology itself and how it works. Introduction to pathology. The field of pathology is devoted to understanding the causes of disease and the changes in cells, tissues, and organs that are associated with disease and give rise to the presenting signs and symptoms in patients. There are two important terms that students will encounter throughout their study of pathology and medicine. It is etiology and pathogenesis. Let's talk about etiology. Etiology, so here it's better shown on this diagram. So etiology collects all the causes of disease. Okay, someone tried to join. Yeah. We have etiology is a cause of disease, and causes are classified here. There might be caused by toxins, infections, immunologic abnormalities, genetic abnormalities, inherited and acquired, both genetic abnormalities causing, so might be cause of disease, nutritional imbalances, trauma. All of this can cause injury to cells and injury to physiological functions of cells, and this is known as etiology. So etiology answers to the question why injury happens, why disease occurs, and this term is etiology. Then let's move to next step. Next question you should ask yourself. It is how it happened. So please switch your microphone off. Please, microphones off, guys.
Игорь Алексеевич, здравствуйте.
Да, Агент Тумушина. Я записываю сейчас это на YouTube.
Да, я поняла, извините. А вы не могли бы попросить студента включить
Включить что?
Лица включить, то есть камеру.
Okay, guys, please switch. So turn on your camera. So we need to see your faces, that you are here. Please, camera on. Okay. Okay, let's continue. So etiology, it's a cause of disease. Then it leads to pathogenesis, and pathogenesis answers to question how. And actually, this is it's toughest question which you should answer. So how, it never easy answer. So how in the question how, you should answer the you should explain the every detail, how it's what's the sequence of events which are causing this injurious stimuli. And then finally, this pathogenesis leads to molecular, functional, morphologic abnormalities in cells and tissues. And these events we are going to discuss in this lecture too. in this set of lectures. So this lecture is divided into 4 lectures, both in pathological anatomy and both in pathological physiology. And I'll show it. And we will discuss it later. And finally, when all these changes happened, we can see the clinical manifestations, signs and symptoms of disease. So signs and symptoms, now as we are students, you're second year students only, we learn it in this sequence: etiology to pathogenesis, then to molecular functional and morphological abnormalities, and then only after this we learn the signs symptoms of the disease. But when you became a doctor, so when you will become a practitioner doctor, so you will learn the in backside. So first of all, you'll find the symptoms, signs of disease. Then you should assume what is the molecular, functional, and morphological abnormalities lead to this, and then you should understand the pathogenesis of the disease, and finally you can give the diagnosis. So the etiology of the disease, and only after all the steps you can prescribe the treatment to the patient, only from the symptoms to the etiology, and then and only this is the best way to treat patients. So when you learn him totally, so this is in clinical subjects you will learn better. Okay, let's turn back to this. Oh, sorry. Then, overview of cellular responses to stress and noxious stimuli. Cells actively interact with their environment, constantly adjusting their structure and function to accommodate changing demands and extracellular stresses. The intracellular milieu of cells is normally tightly regulated, such that it remained fairly constant, as that referred to homeostasis. In physiology, we learned what is homeostasis, and cells normally working in homeostatic in state, but there are a lot of changes which can switch the homeostasis to abnormal state. And for example, it might be physiologic stress. It is, for example, increased workload in the heart. Might be in potential injurious conditions. For example, it's nutrient deprivation. Might be the hypoxia. So it's also available. Okay. Adaptive capability is exceeded, or if the external stress is inherently harmful, or excessive cell injury develops. So that is cell injury. Okay, this is let's skip it. And this primitive scheme how the injury happened. So we have normal cell which present in homeostasis, and then we have injurious stimuli which can cause the reversible injury. But if injurious stimulus is stopped, then reversible injury might turn back to normal cell. So that it's also available in our tissues. And then, but if injurious stimulus became severe or progressive, reversible injury became irreversible injury. Irreversible injury is equivalent of word death. When injury can be held, so it causes the necrosis and apoptosis, or necrosis or apoptosis. And we have additional term which is known as necroptosis. So in this lecture we'll not discuss apoptosis because of lack of time, and we have more lectures about it. We will discuss apoptosis later, but necrosis is a term of today's topic. Okay. Because damage to cells is the basis of all disease, in these lectures we will discuss first the causes, mechanism, and consequences of the various forms of acute cell injury, including reversible injury and cell death. We then considered cellular adaptations to stress and conclude with two other processes that affect cells and tissues: the deposition of abnormal substances and cell aging. So in a final lecture we'll discuss these things. Causes of cell injury. So, which changes can affect the cell injury? It is hypoxia and ischemia. So we'll discuss what is it: toxins, infectious agents, immunologic reactions, genetic abnormalities, nutritional imbalances, physical agents, and aging. So it's very it's divided very roughly. So actually, we usually have coordination of these signals, coordination of these causes of cell injury. So we have hypoxia along with toxins, for example. So same as infectious agents with toxins and hypoxia, immunologic reactions are correlated with hypoxia too, and all of this might cause nutritional imbalances. So you see, and also correlate with aging. So everything is intermixed. But just for understanding of this, we subdivided this. But never think that it's only one reason for the damaging. We'll discuss it right now. What is hypoxia and ischemia? So, from the term, you understand that hypoxia it's decreased amount of oxygen in the blood, and a less amount of oxygen into the tissue. To directly, now we're talking about cellular level, and when one cell suffers from loss of oxygen, so it leads to death of the cell. So it leads to first of all not death but injury to the cell, and then leads to death. So deprived tissues of oxygen ischemia, in addition, results in a deficiency of essential nutrients and a buildup of toxic metabolites. So you know that oxygen is predominantly included in the processes inside the mitochondria, and mitochondria can work only with oxygen inside it. Proper activity of hypoxia. And you remember that mitochondria producing the ATP, and along with it, it produces the CO2 and H2O. So we intake the nourishment inside the mitochondria, and then mitochondria rearrange it with help of oxygen. It activates the oxidative phosphorylation, which is known as Krebs cycle. But and as a result, we produce a lot of ATPs. So, and a decrease of oxygen level causing two outcomes. First of all, we have decreased ATP, and that's why most of our organelles inside the cell are working with help of ATP. And secondary, there are produced a lot of injurious toxins, toxins which used to be used to be present only inside the mitochondria, but now they must leak outside the mitochondria. Okay, and cause of this hypoxia and ischemia are different. So hypoxia is a decrease not just of oxygen level, but ischemia when we have deprivation of blood itself. So, for example, usually it is related to with clotting or any kind of damaging of arteries. So obturation of arteries that can cause the ischemia. So that's what is it. And one of the most common cause of cell damage and later necrosis, it is hypoxia and ischemia. Let's talk about later. Toxins. Toxins, potentially toxic agents are encountered daily in the environment. These include air pollutants, insecticides, CO, asbestos, cigarette smoke, ethanol, and drugs. So entire toxins are well discussed in topic of toxicology. So actually, the very large amount of pathogenesis, large types of pathogenesis caused by every toxin, and pollutants, insecticides, all of them are different in their activities. That's why now we can't show something common for them. But keep in mind that toxins might cause cell injury. Infectious agents. Infectious agents like viruses, bacteria, fungi, protozoans, they can injure cells. Also, pathogenesis of this is well explained in microbiology topic, and later in infectious diseases. We have two different subjects in your preparation for being future doctors to explain these infectious agents in details. But also we can't avoid explanation of this in pathology too. But it will be more superficial than in this topics, these subjects. Please pay attention to this now, then it will be easier to learn further subjects. Okay, and immunologic reactions. Immunologic reactions are also discussed in immunology. Immunology is also a department of is a huge department of medicine, but also main mechanisms of immunologic reactions are discussed in this semester. Um, and these immunologic reactions include the autoimmune reactions when our own immune system starts to suppress our own immunity, so our own cells. They can kill it, they can destroy it with the help of some chemicals. They can okay, about details about of this we'll discuss in a few more after a few more lectures. Genetic abnormalities. Genetic abnormalities are learned much later in after the inflammation topic, and but keep in mind that genetic abnormalities they are not only inherited. As genetic abnormalities might be inherited and might be acquired, and DNA damage, so causing the activation of systems inside the cell which prevent the DNA damage. And if we can treat the DNA, we can return back normal DNA sequence. This cell will survive. But if we can't, so our own mechanisms of cell death, so we'll destroy them. So especially by process known as apoptosis. Okay. Also, genetic abnormalities might lead to formation of misfolded proteins. So proteins which sequence is not proper. So sequence which is not which previously encoded. And these misfolded proteins also has a mechanism by which we can kill our cell. So when cell commits suicide, just because of misfolded proteins inside it. And this will be discussed in the next lecture. Nutritional imbalances. Nutritional imbalances, so it's about protein calorie insufficiency along with vitamin insufficiency, and that's nowadays in most countries of the world we don't know about this because usually we have normal protein calorie in count to the body and absolutely normal amount of them. But still, we have some countries, especially in Africa, which suffers because of starving, and for them, this topic is very so. This topic is very actual for them. But another nutritional imbalance, which is more common for well-developed countries, is a dietary intake. Excessive dietary intake, which causes obesity and diabetes type 2, diabetes mellitus type 2, and atherosclerosis. So about this, we also discuss. We have a distinct lecture about these nutritional imbalances and what they cause in our tissues. Physical agents. So trauma, extremes of temperature, radiation, electric shock, and sudden changes in atmospheric pressure all have wide-ranging effects in cells. So some of them will be, as examples, will be explained to you in later parts, later in this lecture. Aging. Cellular senescence results in a diminished ability of cells to respond to stress and eventually the death of cells and of the organism. The mechanisms underlying cellular aging are discussed at the end of this chapter. This chapter will end with the fourth lecture. So let's be ready for this. With this introduction, we proceed to a discussion of the progression and morphological manifestation of cell injury, and then to the biochemical mechanisms in injury caused by different noxious stimuli. So, okay, sequence of events in cell injury and cell death. Various injurious stimuli damage cells through diverse biochemical mechanisms. All tend to induce a stereotypic sequence of morphological and structural alterations in most types of cells, and that's what we should discuss right now. We have reversible cell injury. This reversible cell injury happens when injury occurs not severely, not acutely. So when it's chronic and not too much. Yeah. So then cell is a little changed itself, and then but if stimuli read out here of this, so this cell might become normal again. So that we'll discuss right now. For example, irreversible injured cells and intracellular organelles typically become swollen because they take in water as a result of the failure of energy-dependent ion pumps. So this mechanism, so I'll show you with diagram. But keep it in mind that pumps are most important in maintenance of water balance inside the cell, and large intake of sodium, large intake of water will cause the swelling of this cell. Leading to an inability to maintain ionic and fluid homeostasis. In some forms of injury, degenerated organelles and lipids may accumulate inside the injured cells. So, morphology of reversible injury. So, let me show it on this diagram. So, here we see the normal cell. This is a normal cell with all normal functioning, so it is in the process of homeostasis. So, works absolutely normally. But when a reversible injury happens, so mitochondria can't produce enough ATP, then rough endoplasmic reticulum swelled and ribosomes detach from the surface. So because of injury, ATP is not produced enough, and that's why sodium potassium pumps are not working here, and they don't pump sodium outside the cell. As you remember, so that inside the cell we have more potassium ions, outside the cell we have more sodium ions. And here, when injury happened, so we can't sustain this position because sodium passively enters inside the cell through the sodium channels, but can't actively be removed by sodium potassium pump because of deprivation of ATP. Also inside the cell we can find myelin figures. Myelin figures are the like blebs of cell membranes. So different cell membranes are like from Golgi apparatus or from other organelles, so smooth endoplasmic reticulum, they don't work properly and they start to fold themselves into the multiple layers of myelin. So firstly, you learned what is myelin. Yeah, so you remember myelin from the nervous system, from the nervous tissue. And the nervous tissue, myelin is made by Schwann cells, which constantly wrap around here and form a thick cell membrane layer. And approximately similar composition of these myelin figures are visible in microscopic review. So, and this is reversible, and and also inside are collected some droplets. They are fat droplets, which are referred to the term as fatty changes. So let's talk about it a little later. So Intracellular changes associated with cell injury include plasma membrane alterations such as blabbing, blunting, or distortion of microvilli. So, because of swelling of cells, so blabbing occurs because usually a cell structure is maintained with the help of a cytoskeleton, but when it's swollen, so this cell membrane with water will blab it outside. It outputs it a little bit, and potentially later it causes the rupturing of cell membrane, and it will come to irreversible injury. Then distortion of microvilli. So in cells with microvilli, you know that microvilli is just projections of cytoplasm, and when they get swollen, they'll become straight. Instead of being swollen, they became straight. And loosening of intercellular attachments. So when swelling occurs, so these tight junctions and the gap junctions between cells get interrupted because they grow inadequately to each other, and of course disruptions happen. And this we would see in our histological examination. Then mitochondrial changes, so as I said before, is swelling and the appearance of phospholipid-rich amorphous densities, because the phospholipid amorphous densities. Sorry. Okay, phospholipid-rich amorphous densities that are Myelin figures. Okay, deletion of the ER with detachment of ribosomes and association of polysomes. Sorry. Sakip, I'm listening you, so now lecture is in process. Then, okay, we stopped here. Deletion of the ER with detachment of ribosomes and dissociation of polysomes happen due to injury, so might happen. And nuclear alterations such as clumping of chromatin. So chromatin get clumped, and so with help of endonucleases, so they are um, they will destroy the nucleus with all the DNA inside. But now they don't. They are just preparing for the damaging. So it's chromatin just clumped before the dissolution. Okay, this diagram I already shown. So you see chromatin is also little condensed. Nucleus also shrinks a little bit, so we'll discuss it a little later. Mitochondria swelled, endoplasmic reticulum swelled, membrane so blebs if it possess the if it possesses the if it possesses the microvilli, so microvilli will be straight. So in beginning of swelling. But later, when injury became irreversible, so when in progressive injury, so cell membrane ruptures, and this is called as necrosis. So about the pathogenesis of necrosis, we'll discuss a little later. In some situations, potentially injuries in cells induce specific alterations in cellular organelles, such as ER. Smooth ER is involved in the metabolism of various chemicals, and cells exposed to these chemicals show hypertrophy of the ER as an adaptive response that may have important functional consequences. Okay, in easy words, so all of this stuff I'll explain in easy words. So, in case patient is in case patient suffers with so intake of alcohol, so alcohol intake too much to this patient, or might be some other barbiturates predominantly inside the body. They are toxins, yeah, and you know that one organ is more active in antitoxicity function. It is liver, and toxicity is reduced with the help of P450 system. So it's a cytochrome system. Cytochrome P450 for P450 will change the structure of this toxin from lipophilic or hydrophobic into the hydrophilic condition. So that's why we can reduce the amount of this drug or any toxin and remove it by kidneys. So you see this sequence. Then liver will detoxify it, but kidney will remove it outside. So, and this system, cytochrome P450, is located on the smooth endoplasmic reticulum of the liver. And in cases of chronic irritation of liver with alcohol or something else, or some other drugs which causing this P450 stimulation, it causes the chronic injury to the cells, and the function of smooth endoplasmic reticulum, besides the antitoxicity function, is to produce lipids, and smooth endoplasmic reticulum produces lipids, too much lipids, and it causes the fatty changes which we'll discuss a little later. Okay, with persistence of excessive noxious exposures, injured cells pass a nebulous point of no return and undergo cell death. Then that's where the cell injury might become the irreversible. Then reversible changes became into irreversible. The clinical relevance of defining the transition point is obvious. If the biochemical molecular changes that predict cell death can be identified, it may be possible to devise strategies for preventing the transition from reversible to irreversible cell injury. Although there are no definite morphological or biochemical correlates of irreversibility, it is consistently characterized by three phenomena: the inability to restore mitochondrial function, even after resolution of the original injury. Then second, the loss of structure and function of the plasma membrane and intracellular membranes. And third, the loss of DNA and chromatin structural integrity. As discussed in more details later, injury to lysosomal membranes results in the enzymatic dissolution of the injured cells, which is the culmination of necrosis. So, cell death. So, when cells are injured, they die by different mechanisms depending on the nature and severity of the insult. So severe disturbances such as loss of oxygen, nutrient supply, and the actions of toxins cause a rapid and uncontrollable form of death that has been called accidental cell death. The morphological manifestation of the accidental cell death is necrosis, from Greek nekros equals to death. So keep it in mind. Necrosis is a major pathway of the cell death, and many commonly encountered injuries, such as those resulting from ischemia, exposure of toxins. So please, we're stopped. Necrosis is a major pathway of cell death, and many commonly encountered injuries, such as those resulting from ischemia, exposure of toxins, various infections, and trauma. Necrosis is traditionally considered the inevitable end result of severe damage that is beyond salvage and is not thought to be regulated by specific signals or by chemical mechanisms. That's why different necrosis is a disaster of the cell. So when cell is unable to continue life, survive, and happens accidentally and never programmed, and that way we have different pathways of necrosis, and when cell fail or fall apart. So that is, and some mechanisms we'll explain, but keep in mind that cell death is usually unprogrammed, and that by manifestation and type of cell death might be absolutely different in accidental way. So let continue the lecture. So this we discussed. yeah, that we discussed. Okay, morphologic changes during the cell death. Okay, here you see the example in diagrams. This is a book of Robin's pathology book, the tenth edition. Sorry. So here you see the normal kidney. You see, cytoplasm is pink, but not very pink, yeah, because of acidic stain eosin. Nucleuses are colored with blue color because of hematoxylin inside, and you see microvilli on the surface. They are like usual microvilli. They are teeny tiny, thin projections inside the inside the tubules, convoluted tubules of kidney. Okay, here we have the reversible cell injury. So I'll stop your attention on this cell. So let's check the differences. Yeah, first of all, look on nucleuses. Nucleus is shrinked. So here we have a pretty huge nucleus. Here it's less in size and more concentrated. This is known as pycnosis, karyopyknosis, and I'll explain it to you a little later. Then cytoplasm. So compare this cytoplasm and this cytoplasm. Cytoplasm here is much more pinkish. Yeah, so because of what? Here inside the cells which are injured, so proteins, they stop being tertiary structured. You remember we have primary, secondary, tertiary, quaternary structured proteins. And the loss of the structures when quaternary became tertiary, tertiary became secondary, secondary became primary structure, and primary ruptures into the small amino acid sequences. This process is known as denaturation of proteins. And actually, during the cell injury, some proteins became denaturated, and as well as they denaturated, they became more straight, and they can adjust more stains. And as we see here, they adjust more stains like eosin, and eosin is pink in color, so it allows these cells to be pinkish. But here it is much more pink because of more proteins, and so experienced pathologists can easily distinguish the injured cell from uninjured cell. And also pay attention to microvilli. So microvilli here, so as you see here, well structured, and one cell is followed by other microvilli. So and it goes as perfect round here. But here, what happened here? So you see, microvilli are different. Somewhere they disrupted. Inside the tissues, we can find some cell debris. So there's already dead cells are present here. So we can't find the cell with okay, it's about necrosis actually. We'll discuss it now. So let's talk about necrosis, sequence of necrosis. How is it promoted? So features of cell necrosis: cell size. In necrosis, it became enlarged. Nucleus undergoes a process known as karyopyknosis, then karyorhexis, and then karyolysis. Karyopyknosis, it is a nucleus became condensed and get ready for the dissolution. But later it undergoes a karyorhexis. Karyorhexis, so I'll show to you somewhere here, I guess. Yeah. So here is a typical karyopyknotic nucleus. It's shrinked, yeah, and shrinked is ready for damage. But karyorhexis, when nucleus is still present, but you see it's the margin of nucleus is not straight. So because nucleus itself became blebbed and forming something like vesicles filled with nucleic acids. And after this, after nuclear karyorhexis, it follows with karyolysis. Karyolysis is when a cell is nucleus inside the cell is absent. Why it happened? Actually, during the histological sample preparation, all the small molecules, so small molecular compounds, get dissolved and washed out during the preparation, and that's why all these nucleic acids which are used to be collected inside the cells, so as you see here and here, they just washed out, and we have only borders of the cell with the proteins inside. That's why we see this pinkish in color and without nucleus. Okay, one more point why cytoplasm became pinkish. Actually, when I said you before, in endoplasmic reticulum, ribosomes also detached from their rough endoplasmic reticulum. Ribosomes are they are accompanied with RNA, ribonucleic acid. It is acid, and that's why it's adjust the so not adjust it's attaching the basic stains, and basic stains attaching to this create this color, yeah, pink plus blue color. This is typical pink plus blue color, but here you see it's totally pink color because ribosomes also detached and destroyed, and that's why that tissues and that cells are usually visible like this in pinkish colored tissues. Okay, let's move forward. Uh, so that's about apoptosis. But another type of cell death is known as apoptosis. So apoptosis is programmed cell death, so which it is caused by less severe injury or more typical type of injury. So we'll discuss it a little later in next topic in details. So morphology I explained: cytoplasmic changes, nuclear changes. Nuclear changes are including the karyopyknosis, karyorrhexis, and karyolysis. And fates of necrotic cells. Necrotic cells may persist for some time or may be digested by enzymes and disappear. Dead cells may be replaced by myelin figures, which are either phagocytosed by other cells or further degraded into fatty acids. These fatty acids bind calcium salts, which may result in the dead cell ultimately becoming calcified. And here we gradually come to the morphologic features of tissue necrosis. This is actually pathological anatomy features. So here you see example of coagulative necrosis, and also this is also coagulative necrosis of kidney. This is macroscopically, this is microscopically. What is visible here. So actually this happened when clotting of renal artery. So one branch of renal artery happened, and you see this specific pattern. This is trigeminal shape of this necrosis. Yeah. So this cells in this area are dead. And here you see the comparison. So you see very visible. So here you see the dead cells without nucleuses. Yeah, no nucleuses are located here. So some inflammatory reaction happens here. Okay, it will be later. Later we'll discuss it. But here you see structure are well visible. Yeah, it's little blabbed, it's little increased in size, swollen, yeah, but still present. We can see this is glomerulus, yeah, and Bowman's capsule is visible, and we can distinguish here some convoluted tubules. But here these convoluted tubules are present with dead cells inside. Let's talk about morphologic patterns. By morphologic patterns, we subdivide the necrosis by coagulative necrosis. And coagulative necrosis is a type of necrosis in which proteins, which I explained before, when proteins became denaturated, and denaturated the primary structure of these proteins, and all the cytoplasm became eosinophilic, as you see here, so pinkish in color, and as well as it is pinkish, so it has more and more protein derivatives, and this coagulative necrosis is more common for infarctions, loss of oxygen supply. So it happens because of increasing of acidic milieu. because mitochondria cannot work. It produces a lot of acidic products like lactic acid and pyruvate, and due to this, proteins get destroyed in this way. So usually, and also acidic toxic injury causing the coagulative necrosis. So it's coagulative means this injury. So also it is shown on this diagram. You see, density of this injury is much higher than, so it will be more solid and has direct borders. And this kind of, in if we could choose the type of necrosis. So this type of necrosis is much better than other types of necrosis, which we are going to discuss later. Then next type of necrosis, so second most common type of necrosis is liquefactive necrosis. Liquefactive necrosis is usually promoted with the help of bacteria and also with our immunity cells. So liquefactive necrosis happen when a large amount of bacteria happen in one area, and our immunity cells destroy it by liquefaction. Liquefaction means we make them more like liquids, like making liquid from solid tissue, making it liquid. So this is typical for the bacterial invasion in types of abscesses, and these abscesses forming the pus. You heard about the pus. It is injured tissues, which are injured tissues with so which is liquid in their matter. And one example, so please remember this example. One example of liquefactive necrosis, so without impact of bacteria, it is happening brain infarction. Brain infarction is exception. So usually infarction, I said, causing the coagulative necrosis, but in the brain, infarction of brain causing the liquefactive necrosis. Usually infarction produces coagulative necrosis. I confused, sorry, but infarction in brain causing the liquefactive necrosis. I repeated it 3 times, so please in class I'll ask you about it. So it will be noticed to me that you learned it. Then gangrenous necrosis. It's another type of necrosis. It's always accomplished with bacteria. This gangrenous necrosis is accomplished with bacteria. Predominantly, it's a Clostridium class of bacteria, Clostridium. We have 2 types of gangrenous necrosis. It's wet necrosis and dry necrosis. So dry necrosis is typical for limbs. When when injury goes to limbs with this bacteria, so usually it resembles the coagulative necrosis by its patterns, but involvement of bacteria makes us sure that this is a specific type of necrosis. This is it's present usually in limbs when it's also in cases of artery damage, in artery clotting of the limbs. It causes the gangrenous necrosis, dry gangrenous necrosis. But in inner organs like in lungs or digestive tract, so the injury is a lack of blood supplyment causing the wet gangrene, because bacteria inside the digestive tract they start to destroy our cells. They and usually it's present in inner organs because it possesses more water intake there, and that's why it will be liquefied. And this wet gangrene is very resembling the liquefactive necrosis, but affection with the bacteria so makes it like a different type of necrosis. Then caseous necrosis. Caseous necrosis is most often encountered in foci of tuberculous infection. Caseous necrosis is always tuberculosis, so almost always tuberculosis. Caseous means cheese-like. Cheese. So this cheese-like appearance referring to the friable yellow-white appearance of the area of necrosis on gross examination. So this cheese-like necrosis. So once again, in tuberculosis, sometimes usually it happens in lungs, but everywhere else when tuberculosis bacteria will reach to other sides of the body, so it will present with this casus necrosis. Unlike coagulative necrosis, the tissue, let's read it, architecture is completely obliterated and cellular outlines cannot be discerned. Casus necrosis is often surrounded by a collection of macrophages and other inflammatory cells. This appearance is characteristic of a nodular inflammatory lesion called a granuloma. So this we'll discuss a little later. So this is typical casus necrosis. You see it's cheese-like appearance. So it's in the Russian tradition, it's named as cottage cheese. You know cottage cheese, and it really resembles a cottage cheese in appearance. And and cell debris are absolutely impossible to distinct the cell, one cell from another cell here. And this is a microscopical examination. So here we see the cheesy appearance. No, it's fibrinoid necrosis. We'll discuss it now. Fat necrosis. What is fat necrosis? So this diagram represents it. So fat necrosis happened in only specific areas. So fat necrosis happened only in our digestive tract, not in digestive tract actually, but in our stomach. So who's calling me? Okay, never mind. Then necrosis. In this type of necrosis, it happened only near the pancreas. When pancreas is damaged, so you remember the pancreas producing three types of enzymes. They are lipases, proteases, and carbohydrate. So amylases. Yeah, these three types of enzymes are produced, and when we have injury of the pancreas, so in pancreatitis, especially in pancreanecrosis, when pancreas is died, these enzymes leak outside, inside the tissues of the peritoneal cavity. And in peritoneal cavity, and we have amentum bursa. Yeah, you remember amentum bursa, which possess a lot of fat inside it. And lipases, which are present inside so one of consistent of the pancreas, they start to destroy these lipids, these triglycerides, and free fatty acids, which are produced here. They start to collect calcium, which is present around. And this chalky appearance is present, like chalky appearance, like soap-like appearance. It's a process known as saponification. It happens inside the tissue here, and it's saponified, and it looks like soap or chalk appearance in this area. So it's a very specific type of necrosis, only typical for pancreas necrosis. It will be discussed only in digestive tract pathology, might be next year. Then we have finally we'll reach the fibrinoid necrosis. Fibrinoid necrosis is a special form of necrosis. It usually occurs in immune reactions in which complexes of antigens and antibodies are deposited in the walls of blood vessels, but it also may occur in severe hypertension. Deposited immune complexes and plasma protein that leak into the wall of damaged vessels produce a bright pink amorphous appearance on hematoxylin and eosin preparations called fibrin-like by pathologists. The immunology-mediated disease is polyarteritis nodosa. So here it's shown, we'll be discussing chapter number 5, and visible in this figure. You see this pinkish appearance, it's a fibrinoid. So these proteins, denaturated proteins, which present around the blood vessel. This is blood vessel. Wall of blood vessel became very thick, and this imbibition of fibrinoid components here, so we'll call this changes. Leakage of intracellular proteins through the damaged cell membrane and ultimately into the circulation provides a means of detecting tissue-specific necrosis using blood or serum samples. Cardiac muscle, for example, contains a unique isoform of the enzyme creatine kinase, its MV fracture, and of the contractile protein troponin, whereas hepatic bile duct epithelium contains the enzyme alkaline phosphatase and hepatocytes contain transaminases. Irreversible injury and cell death in these tissues elevate the serum levels of these proteins, which makes them clinically useful markers of tissue damage. So in the practice of the in practicals, we will discuss this. So how we can use this enzyme of blood in diagnosis methods. And okay, on this our lecture stops. See you next time. Tomorrow we have another lecture of pathology. We'll continue with topic of apoptosis. Please, yeah, I heard a lot of questions about the what should you do with your lecture notes. Your lecture notes should be you should write your lecture notes because in practicals I will check it out and give you marks for this lecture notes. So, but you shouldn't write entire lecture. You shouldn't rewrite the book. I don't need rewriting. I need only the main concentrated information there. You can find it in the book. You can find it in my lectures. You can read it. Yeah. So just in easy in a shortened form. I need it in shortened form. So okay, final checkup of students.
Yes, sir.
So my request to you: write your lectures right now. Start to do it because later you won't want to write it. You'll forget to write it, and then in last day you'll write it in this way. So it's bad attitude. Okay. Yes.
So we will write the
Yeah, you should.
lecture.
Yes,
We
write the
will write the
lecture down.
lecture.
Of course, of course. You need to have conspect. Of course, it's in any way.